Okay, so good morning, everyone. So today I'll be taking a class on a small topic on small family norm. So any idea? What do you think? What it will be? Small family norm?
Ma'am, family planning, ma'am.
Yes, very good. Okay, so small family norm is like how we are trying, because as we all know, we have learned about population explosion, right? We have seen what can be the causes of population explosion, what can be the ill effect, or what are the various effects which can hampers our health, not only health, everything because of population explosion. So in order to control a population explosion, okay, so our government they have tried some initiative where they have started with the concept of small family norm. Okay, so whenever we say small family norm, is like we are trying to give them some this one like we are trying to make them aware, like what are the, like how many family members. When we say small family norm, usually in India, in our country, it means like each and every family they should have at least only two children. Okay, so after they have two children, so they should adopt for any permanent methods like your vasectomy or tubectomy. So like this, why we do small family norm is that initiative, because as you all know, our population is already exploding like anything. We are the second most populous country, and if we don't follow this, later on we will be the most populous country. And when that happens, so many things will like so many careers or ill effects will happen. People will not get job, people will not get any medical services, some people will starve to death because of poverty. Then everything will, even our economy will be affected. So in order to control that, our government have started with the initiative of small family norms. Okay, so I'll be sharing my slides now. Is it visible?
Yes,
Yes,
ma'am.
ma'am.
Okay, so if you say small family norm, even in the diagram you can see, okay, so they have only two children. So two children, so either it can be a boy or a girl, or it can be anyone. Okay, so that no family should have more than two child. Okay, so why we focus on small family norms, we'll be seeing later. Okay, what are the benefits of small family norms? Okay, so what can we do in order to maintain or to initiate small family norms in the community? So if we say okay, when we have this, actually we have in community, we have some specific program which is called as the family welfare program. So family welfare program, it is not only related to family planning, it is involving all the other activities which will improve the health of the family, be it their education, be it their occupation, their health services, then health of the mother, health of the children. So it involves the health of all the family members. Okay, related to all these family welfare program, you'll be learning more in details when you will reach your fourth year. Okay, so for now, the main thing that you need to know is about family planning. And for this, I think I have given Rita, right? Rita, I think I have given you as a seminar. So you'll be seeing more in details what are the various methods which we can adopt for family planning. Usually for family planning, we have two types. We have the temporary method and the permanent methods. Okay. So likewise, so when the people are already having, or a family, if they are already having two children, so we usually opt them to go for permanent methods. Okay. Because from the word itself, temporary means even though you give this uh, family planning method, but it is not for a permanent, it will not stay permanently. So once we tell them to go for opt for permanent method, that means it will be permanently, they will not be having any more child. Okay, so if you see, a significant achievement of the family welfare program has been achieved of the fertility rate from 6.4 in 1950 to 4.2. So in our main focus in our country is reduce the fertility rate, because the more the increase in the fertility rate, it indicates that many children are being born, or more and more our population will increase. So our main aim in our country is to reduce actually the fertility rate. Okay, that's why only we opt them to go for all these permanent methods. We try to make the people go for temporary method, even those who are having less than two children. Okay, so, and the national target is to achieve a family size of 2.3 by 2000 AD. Okay, and all the efforts are being made. How it is being done? Mostly, it is done through mass communication, like where the people will be gathered in some specific at a specific timing. So we'll gather all the families or all the people in the community. We will educate them about what are the various methods of family planning. We'll tell them about what do you mean by small family norm. how if they adopt small family with only two children, how it will really benefits them. So all those is done under the mass communication. When we say mass means
Ma'am, your voice is breaking, ma'am.
my voice is breaking. Now, is it clear now?
Yes, ma'am.
Okay, I think because of some network issue. Okay, so when we say mass communication means like the communications where we used to give on a large group of people. Okay, so in this type of mass communication or mass gathering, we can, in what we can do, we can educate the people about small family norm. Okay, so I'll tell you what do you mean by small family norms. So, like I said, small family norms means a family of two or less children. Okay, it might be two or it can be less than that. Okay, so this type of family we call it as a small family. And as a saying goes, I think everyone knows, must have heard of this. A small family is a happy family, right? Because when we are having a very small number of people in our family, we'll be able to give them proper food, proper education, proper clothing, and every aspects also it will really help, and even it will help in the relationship also, it will help in maintaining a very good relationship among all the family members. So that's why a small family is always better. Okay, so what are the basic human needs?
Yes.
Today we have so many basic human needs like income, education, health, and nutrition. Okay, so how here we will see like how the size of the family really affects, okay, the quality of life of human beings, and the family life it is affected in various spheres of life. So with how the family size really affects all this basic human needs. Okay, so we'll see one by one. So the first one is the income. Okay. So likewise, like I've said, if the increase in family members, that means it will also lowers the per capita income of the family. So if you have 10,000, instead of dividing that, suppose if you have only three members in a family, the husband, the wife, and the one child. So he can divide it. It means he can manage easily among three individuals. But suppose with that 10,000, if there are 10 family or members or 11 family members, that means each family members will be getting a very less this one. They mean they will be able to divide it in a very less quantity for each, and sometimes it might not even be enough. Okay, for each and every family members. So like this, we can see that with an increase in family size, that means you will also get the low per capita income, or even it will also reduce. And if the family size is less, then it will be equal, or it will be better for the family. Okay, so the lower per capita income leads to low domestic saving, lesser resources for economic development. So like incomes not in only in the family, it also comes related to the how it really affects the economy of the country as a whole. So if the people are having less family members in each house, so they'll be able to save more, and they'll be able to contribute more. Okay, so the economic development of the country. And small rate of economic development of family and community, it is also achieved if the family is size is more. So that like this we can see like how a family size really affects the income of the or the income or the economic development of the country. So the lower the size of the family, so the bigger is the or the more is the economic development of the country. And the next thing it says nutrition. Okay, so an increase in family size results in per capita food, decrease in the per capita food and nutrition and health standards. Yes, this is very true, because if many family members are there, so even the government also, even the food production will be very less. Suppose if a food which was supposed to be eaten by for two members, it needs to be shared by five, six members. So in this era, what will happen? Hello?
Yes, ma'am.
Okay, I was having some network problem.
Yes, ma'am.
Share the screen again. Okay. Okay, so I think you understand, right? So if the less family members, that means the people in each family also they'll be getting more food, or they'll be able to get adequate food, nutritious diet, as compared to a family with more numbers. Okay, more when there are more members in any family, so it will also help. It will also help. It will, like, all the members in the family, they won't be getting adequate and nutritious diet. Okay, so the next comes the health. Okay, so how it's really affecting, especially for the women. Okay, so as it has been seen that early marriage, it followed by, because if a girls get married early, obviously her reproductive age, actually a reproductive age, it is considered from 14 to 45 years. So it is during this period where the woman can, she, this is the reproductive age where she can bear a child. Okay, so obviously if a girls get married very early, that means her reproductive age also will be very, the length of the reproductive age will be more, and in that period she can have many children. But if she get married a bit not late also, like suppose at around 30 years or 28, like 26, so if she get married in that age, so her reproductive age also will be less, and she will also reproduce less children as compared to those who get married early. And this, if a girl get married very early, how it affects her, she will be having more children, then even psychologically it will be affecting her health, and it will also affect our physical health. Okay, so she will not be get some, especially if a woman gets pregnant after every 1 year or 2 years, so her body also does not get the proper chance in order to regain back whatever strength, okay, that she have lost during the first pregnancy. So it affects her physical health. Psychologically also it affects the health of the mother, and not only the mother, it also affects the well-being of the child. So the mother won't be able to give that much emotional support to the children, because she gets pregnant, means she got pregnant after every 1 year or 2 years. So this, it really affects the health of the mother as well as the health of the child. Okay, so that's why we always used to advise the child, at least the woman, to get married by the legal age of 18, and for male it is increased to 21 now. Okay, so why we do this? Because by 18 years, at least a woman, she will be an adult, she will be at least, she will be knowing at least what are the various aspects of taking care of the child. Okay, so how to deal with all the psychological stress. So that's why we don't initiate early marriage, because the more the child will get married early, the more she will, it will really affect her health, physical health, emotional health, psychological health, all it will be affected. And not only that, it will also affect the child. Okay, so the next is comes education. Okay, so the family size is seen to be related to education. Where the mother education is very high, the family size is usually smaller, and the infant mortality is also lower. Okay, so when we say infant, means these are those child which is less than 1 year of age. Okay, so within 1 year we call them as infant. So it has also been seen, that's why they used to say education, if you educate, there's a saying that says if you educate a mother, that means you educate their entire family. So that's why education of the mother is very important, because she is the one mostly who will be handling all the this one issues related to the, and even if you say in the house, she will be the one preparing the food. So if she have a very good nutrition, she will be able to provide good food with adequate nutrition. Okay, she will have a very basic knowledge about what are the various nutritious diet. And not only that, it will also help in even in family planning, because if you see, okay, there's so much difference. Even if you go for your home visit, you will see that, because if a mother is educated, even if you try to advise her, to tell her about how that she should adopt and use some family planning methods, like, she will understand whatever you're trying to say and she will accept. But if, okay, if you go to any family where the mother is not educated, or she might be illiterate, so she might not be accepting whatever offer you're giving, because of maybe some beliefs, or she might still be at doubt. Okay, so that's why education also is very important, especially the education of the mother. And education of the mother also, it really affects the numbers of children in a family, or the family size. So what are the hazards of large and unplanned family? So but till now, anyone have any question? Hello, hello, anyone have any doubt till now?
No,
No,
ma'am.
ma'am. No,
No,
Okay,
ma'am.
so if
ma'am.
you have any question, you can
No,
start
ma'am.
asking. So just
No,
remember this,
ma'am.
No, ma'am.
you have to remember that each and every aspects of human needs. So the more the population, that means the more will be the ill effects. Be it income also, be it your health, be it your education, okay? Nutrition, so all it's affected if the family size is small. So next we'll see what are the hazards of large and unplanned family. So too early marriages leads to hazards and pregnancy and childbirth. So what are the hazards which can be seen because of early marriage? Okay. So first of all, it can lead to abortion. Okay. Stillbirth. Stillbirth means a baby is born, but he is born dead. Okay, we call it as stillbirth. Okay, then premature birth. That means the baby it is born before the 9 months. We call it as premature birth. Increased chance to develop cancer of the cervix, and also discontinuation of job and education. Yes, because if a mother, if she get married very early, some will not even continue her education. She will just stay at home. She will just take care of it kid instead. That is the age where she should go for study. Okay, she should study, she should build up her career, but instead she is discontinuing her job, leaving her career behind, and this it really affects her. Okay, psychologically, emotionally, she will be really affected. Okay, so and the second thing, what does it says? Too early pregnancy leads to increased stress from pregnancy and childbirth. And what are the other thing which comes is low birth weight. Okay, so low birth weight, when do we call it as low birth weight? Is when a child or a baby it is born below 2,500 gram or 2.5 gram. Okay, so that we call it as low birth weight. So the sickness and ill health mother, then increasing mortality and morbidity rate. Okay, mortality means the death rate. Okay, and when we say morbidity, that means the chances of any ill effect of the mother or ill health of the mother. We call it as the morbidity. So as you can see from here, how really if the mother is getting married early or if she's getting pregnant at a very early age, how it really affects her health. Okay, so all these are some of the hazards of too early marriage. Okay, so or too early pregnancy. Then too frequent pregnancy. Too frequent means like within, suppose after 1 year again she have another child. Like it is said that in order for a mother to regain her physical strength or psychologically whatever which comes after the delivery of a child, so at least 3 years gap should be there. Okay, so if she have a first child at suppose 27 years, so the next child she can have at around 30 or 31 years. So at least 3 years gap should be there. So why do we advise the mother to have at least 3 years gap? Because at least her body also needs to regain back the strength, because giving childbirth is not a joke. Okay, so everything is affected physically, psychologically, it is affected during the delivery of a child. So that's why we used to say that a mother should at least have at least 3 years gap in order to regain whatever physical strength she have lost. Then not only that, psychologically also it's really affecting her, and even to be able to give proper care to the child. Okay, if you have frequent pregnancy, that means in the first child you're having at 27, the second child at 29, so you won't be able to provide proper care to the first child, and this will really affect the child health as well as his psychological health later in his life. Okay, and too frequent pregnancy also it leads to similarly here also low birth weight, cancer. Okay, cancer, then even also it might cause some economic hardship, because to again and again the mother is having baby but they might not have that much adequate amount of income, in order to bear all the expenses, okay, of the family. Then the parents attention is divided among the children, like I've said. So if you have frequent pregnancy, so the first child will be like totally neglected because the mother have to take care of the second child. So like that, it will really affect the this one attention of the children. Okay, so and later on it will really affect that child, because that is a time where we need, the child needs not lots of attention. Okay, so if you don't give them the attention when they were small, so later on in their life it would really affect them. Okay, and too many pregnancy also leads to unhappiness, and there can be some kind of disharmony in the family and difficulty in providing proper education to the children. So because they might not have enough expenses or enough income to bear all the expense, so some of the children might just have to stay at home, or they might not get to go to any proper school. Okay, and not only that, they might not get even proper food to eat, and even medical help. Okay, they might not get enough money, have enough money to go for any medical checkup when even when they are sick. So the late pregnancy lead to lose social status and also congenital abnormalities. Okay, so we have also two this effect. Okay, two this one, if you get married early also is too, it's not good, and even too late marriages is also very that. So why too late marriages means if women get married after 35 years, because it has been seen that if a woman get married after the age of 35, so there's a chance that she will have a child with so many abnormalities or congenital. When we say congenital, means any heart deformities. Okay, so the child might have congenital heart failure, or the child might be born with some form of deformities like Down syndrome. Okay, I think you have heard about Down syndrome. So late marriage is also very, it is not good, as well as early marriage. So everyone should get marriage at a very average age, or this one where there will be no type of what to say no type of ill effect to the child as well as to the mother. Okay, so these are the hazards of large and unplanned family. I think you have a now by now you might have a concept. Okay, so why do we that's why based on all these, after seeing all these, so that is the reason why we need to have a small family. So, what are the advantages of having a small family? So, first of all, a small planned family has many advantages and benefits. Okay, so even if you can just say also a family with small family will have enough nutrition, enough education, they will have adequate income to bear all the expenses, they will be able to have a very good relationship. Okay, and the safest time for the pregnancy for health of both the mother and the child, it is said when the mother at least she should be 20 to 30 years. So this is a very safe period, okay, as you can say, for a mother to become pregnant. And the reasonable gap between two children will give the mother sufficient time to replenish her body nutrients, which is depleted during the early pregnancy. Okay, so like I've said also, so whenever our child, like I've said, whenever a mother after delivery, so it will really affects her health. Okay, so in order to regain all those which have been lost during the first pregnancy, so at least 3 years gap should be there. Okay, so that's why now whenever we go for family to the community, we always advise the mother. Like if they're having only one child, okay, we'll advise her, okay, you have to maintain at least 3 years gap, and in between those 3 years, you have to use some form of contraception. Okay, then if she's already having two children, then we'll directly advise her to go for permanent methods. Then what are the advantages we can see for the mother? Okay, so first of all, it helps in maintaining her health, loss of fear about any unwanted pregnancy, then less strain and worry due to less children. Obviously, if there are many children, she'll be, because she have to take care of everyone. Okay, so it will be really affecting her. It will cause a lot of worries. Okay, stress for the mother, then more time and energy for the children, then have more time for any educational vocational activities, so she can focus on those two children, she can really help them with the education. Okay, with training them, better job opportunities. Okay, so if she have only two children, still after, even after her child is born, she can still opt for, or she can just still go for job, so she can still go for, because if she have many children, then she cannot leave those many children at home, right? So she have to take care of those. So if she have less children, she can still go for, and have that she can still work somewhere. Then it can also save the child's health. Okay, so if you have less children, that means the mother also will be providing good health and care to that specific child or to that specific children. So like this, it really, these are some of the advantages for the mother. So if you come, what are the advantages to the child? The child will have a very conducive atmosphere for his proper physical and psychological growth and development. Okay, because he will be getting all the needed attentions that he required. Okay, so he will be getting the proper food, the proper affection from his parents. He'll be getting all the adequate nutrition. Okay, so this, it really helps in creating a very good environment for the child. Okay, growth and development. Then the child also get proper nutrition, education, prenatal care, as well as love. Okay, so so if you say prenatal care, it is that period before a child is born. Okay, then what are the advantages to the father? Okay, so the father can provide children with better education, comfort, food, clothing, recreation. He will also be more relaxed, and he will also be able to enjoy his good health. Otherwise, it is also a lot of strain also is on the father, because mostly in every family, the father is the bread owner of the family. He will be the one providing the family income. So that's what, if the family is less, then it will also make him less stress, and it will also, he will be have enough income to deal all the expenses of his family. Okay, he will improve living standards as well as his better health. The next is what are the advantages when it comes to the community. Okay, so for the community, small family leads to conservation of natural resources and saving. Okay, so the lesser the family, that means the less natural resource they will use, be it your air, water. Okay, so anything related to the natural resource, and also saving. The small family norm helps the nation to have enough schools, enough hospitals, and other basic services like whatever it is needed for people in the community. Because if the people are less, obviously the government also they'll be able to provide all the adequate services for everyone as compared to the if there are more population. The small family yields more employment, then it also leads to happiness and harmony in the country. Okay, so these are the advantages of small family norm. Okay, so you have to remember what are the advantages to the mother, to the child, to the father, and to the community. Okay, so when this, okay, so we'll be seeing what are the practices of small family norm. Okay, so small family norm has to become a way of life for this population should be educated. And what are the main role as a health worker, that means as a nurse. Okay, so what we should do in order to improve this small family norm. So first of all we have to do is to supply the people or the in the community with all the necessary information. Okay, so we have, it is our job to educate them, to make them aware about what is family norm, so what are the advantages of having small family. Okay, so how it will really benefits them, their family, the nation. Then we have to assist the client to evaluate any contraceptive information and services. So it is our duty as a nurse also, we have to, whenever anyone have any doubt related to any family planning methods, okay, some might not be using those. So it is our job how we should educate them, how we should tell them, okay, what are the benefits, suppose what is the benefit of condom, what is the benefit of using different types of contraceptive methods. So all those we have to advise and we have to give them the information. Then to encourage them for continuous use of the contraception. Okay, so contraception, we have so many forms of contraception. Okay, then the health personnel also should be properly trained with proper knowledge to motivate the people. Okay, so we should really have we should be really know how to talk, how to communicate with the people, how to really motivate them to adopt small family. The services agency should be properly geared for effective implementation, monitoring, and evaluation of all the contraceptive services. So some form of agency should be there in the community, and these agencies, it is their duty to make sure that whatever contraceptive devices which is being provided to the community, it is very effective. So they have to evaluate the effectiveness of the this one, and how many people are using, suppose how many people are using what type of family planning methods, how it really, what is the effectiveness of that. Okay, so whether it really helps in preventing any unwanted pregnancy. Okay, so all this needs to be done by this agency. Effective delivery of contraceptive services at the doorstep for people is very effective. Okay, so because some people they might they might not want to adopt any family planning methods, but if you go and give them at the doorstep, so maybe they might use it. Okay, and for promoting acceptance, so our main aim is as a health worker is always to make sure that we have to educate the people in such a way, like we should really help know. Okay, in what to say in such a way that it will really motivate them, it will really help them to accept the family planning methods or the family planning services. So what are the barriers of small family norms? So actually we have two main barriers, okay, in the small family. So So in order to remove this barrier, the first thing what we need to do is information and services to the people. Then change the associated environmental factors, that is increasing in the female literacy and status of women, improving the condition of the women. So with the help of all these two aspects, we can remove these barriers which is there in order to improve the adoption of small family norms. So the barriers are like religious point, like suppose, for example, because of desiring some people, okay, in a family, this is very common in a country, okay. So as the son, he will be the one, he will be the one, okay. So they always, because of desiring of having any son, okay, so they will keep on reproducing till they have a son or they have a boy child. Okay, so this is also one aspect which really affects our population. So as if suppose if they already have two children, okay, if they have,
Ma'am, your voice is breaking.
my voice is breaking now. Also, it's
Yes, ma'am.
now
Ma'am,
also it's
it's
breaking.
good now.
Now it's good. Okay, so sorry. Okay, because of the network issue.
Oh,
Now
it's
it's
okay,
fine.
ma'am. Yes,
Okay.
ma'am.
Are you clear with the this one? What is the role of health workers? This.
Yeah, yes, ma'am.
Okay, so what are the barriers? I mean barriers you understand, right? So what are the barriers of small family norm? So what are the things which really prevents from achieving this small family norm target? So the first thing what does it says is your religious point. Or not only if this not only come as religious, but even if as you can see in our culture, okay, so the male is the one who's performing all the ritual rites, okay, they will be the one all those. So because of that, we have very in a country a lot of family, everyone they desire to have a male child, and because of that, even if they already have two female children, as long as they didn't get a male child, they will keep on reproducing, and in this way it really affects our population. So it will keep on increasing our population. Okay, then children considered social security at a very old age. Ethical uneasiness about the MTP. MTP is the medical termination of pregnancy. Okay, so actually, medical termination of pregnancy, it is the term which is used for, like, in other words, we used to call it as abortion also. Okay, so what happened? Like this is actually when do we do medical termination of pregnancy? Suppose if the mother is having any complication because of the pregnancy, so we need to abort the child. Abort means, you understand, right? Abortion. Do you know? Do you
Yes,
understand what I
ma'am.
mean by abortion? Okay, so this
Yes,
is
ma'am.
actually an act. So and not only that, if suppose if a girl, okay, she might be if she is a rape victim. Okay, so in that case also, then the child needs to be aborted. So they will do MTP. Or if the mother is having a children with abnormality, if the child is already known to be suffering from any form of congenital abnormality, so even in that cases, abortion is allowed. So this is like an act, okay? So, but still many myths are there related to abortion, okay? Because some people they perform only like illegal abortion, like because if you know like because after suppose after knowing that the female is carrying a male child, a female child. So after doing the sex determination, they came to know that it's a female child, and after that also they might perform some illegal abortion. Okay, so the death rate of infant is also very high. Then the lack of recreation or lack of any form of education also, it really cause as a barrier in the small family now. Okay, so in order to remove the barrier, so what are the initiatives taken up by the government? So first of all, they provide some recreation facilities for the mother, for the child, okay, even for the family. Then they educate the poor and the illiterate regarding small family norm, okay, because they might not be aware, because they might not get the opportunity to go to school, so they might not be educated. Okay, so they might have a little knowledge. What are the benefits, real benefits of having a small family? So voluntary maternity of women should have a proper place of information. Okay, then make family planning program a people's program. Why do we need to make it as a people program? Because then only the people participation also will be more if you make it a people program, or if you try to involve more people in the community in the program, so they will also help in adopting the small family norm. Role of voluntary organization means like your NGO, non-governmental organizations. So all these also they can really take up and they can really help in the small family norm. Okay, so like as a saying goes, as you can see from the diagram also, a small family is a happy family. Okay, so in this way, how we should always try and adopt a small family norm. Okay, so this is about a small family norm. Okay, what are the hazards? Okay, so what are the advantages, the barriers, and what are the initiatives taken by the government? So any question?
Ma'am, can you please explain stillbirth?
Stillbirth is when a child is born, okay? Born dead. Okay, that means when immediately when he's born, he's already dead. That is called a stillbirth. Okay. Still means what? It's like
Okay,
not
ma'am.
moving.
Thank
Okay,
you.
it is the other name of not. Whenever we say still means it is being idle, not moving. So that's what we call stillbirth. Okay, and all this actually you'll be learning more when you'll have your ops. This one subject you'll have in 4th year. So you'll be learning more about different types of abortion, okay, stillbirth, and all this. Anyone have any question? Are you all clear with small family norm? This it might come as a short notes also. Okay. Why I'm teaching about small
Yes,
family
ma'am.
norm? Because before going to the family planning methods, we should really know why should we have a small family. So what are the benefits? Okay, advantages, the barriers,